And Trainer David.
So today's topic is going to be the Medicare annual enrollment period, your AEP, and why we're preparing to sell. So David, what's your thoughts on AEP?
Can't wait for it. Gosh, that's a real money-making time of the year. It's that opportunity everybody has to make changes and
outside of the special election period, correct? Great. So let's go ahead and get started, guys. So our agenda, why sell Medicare? Can you sell Medicare? And the next steps. So, and then we're going to go into a MedSep and what you need to know. So for starters, we have the Medicare Part A, also known as the hospital insurance, and the Medicare Part B, which is also known as the medical insurance. We have the Medicare Part C, which is your Advantage plans, like your HMOs, your PPOs, those POSs, remember, point of service. And then, of course, these are going to include the Part A, the Part B, and sometimes that Part D, which, speaking of Part D is also known as that prescription drug plan. So, David, why sell Medicare?
Well, when I look at Medicare, I usually think of it as strictly the demographics as to kind of what's going on. Okay, as we look out there, we can see what's going on in the population, and this graph really kind of tells it all. The baby boomer generation, that's all of those who were born right after World War II, are all turning 65, and it's happening in just record numbers. About 10,000 new people are eligible for Medicare every day. I did the math on that. That really breaks down to about every second, 8 people age into Medicare.
So 8 new people are aging into Medicare every second? That sounds like a great opportunity for a sales agent.
Right. So this is like an ever-growing, ever-evolving market that presents just outstanding opportunities for the agents that want to assist in this aging population. If you look back there at 2010, you see that 1 in 8 was on Medicare, and by 2030, that's expected to be 1 in 4. So it's just, the numbers are huge. If you look at the graph, we're right there in the midst of the steepest portion of the graph. Let's kind of break it down a little bit more so you can see where the sales come in. There's kind of many faces to Medicare, and all of these are marketing segments for us. Okay? We'll start off with what many people would have said, well, there's no money to be made there. Well, that's wrong. It's all those employer-sponsored plans out there. Many of those plans are just going away. The companies are finding them too expensive. And so of that, 1/3 of the people on Medicare are in those plans. And as those plans disappear, they're going to be seeking assistance for how to get into a new plan. Now, that could be either through the AEP, or when they lose the plan, if it's mid-year, it's an SEP. The next big group that you see on there, it says, is Medicaid. About 7 million of those, 15%. Continuous open enrollment for those folks. Okay, they can, well, I shouldn't say continuous, it's actually once a quarter, but there's always the ability to enroll those people into some sort of a Medicare plan. Then we have those that are already in Medicare Advantage. You see it's about 25%, and statistics also tell us that 1 in 4 of those will make a change during AEP. Something will have changed in their life. Either a prescription wasn't being covered well, or they got a new prescription, doctors changed, just a lot of different little factors that can come in. But statistically speaking, we know about 1 in 4 will make a change every year. Then we have those who are on Medigap. Big rules changing in Medigap. And as far as Medigap goes, for pure insurance, that's the way to go. And so people are looking to sometimes make changes, but we have the new people aging in all the time. And the last little group I'd like to point out is that there's about 4 million right now with nothing at all. That means available for sale, that you could either put them in a Medigap, or they may or may not have an SCP. They're going to have if they don't have an SCP, open enrollments around the corner, and so we can help them there. And so that is kind of why you want to sell it. The other factor that comes in is going to be commissions.
Money, money, money.
Show me the money. Well, in Medicare, I've seen commissions, and it always kind of depends on, you know, what product you sell and where you sell it. But you get really good commissions, and so let me tell you, I've seen them up in the $600 range for selling a person in either California or New Jersey, was, if you want to get real specific, that was their first time in Medicare. You know, so they had just aged in, and you were putting them into a Medicare Advantage plan. So while that's just a one-time commission, there's also going to be the high retention. I told you that it's, you know, the turnover is only at about 25%, you know, every year. So, and if you work with your customer, you could be the one doing the turnover, just putting them into a different plan that picked up that doctor or that prescription that they needed. So the retention is great. As far as Medicare supplement plans, you're looking at you know, 15 to 17% of the you know, the annual premium based on which plan you sold and again where it was. The numbers, like I said, 3 million coming in this year alone, plus another 3 million that were already there that didn't have anything at all that were waiting to hear from you. And by 2030, over 65 million people will be in Medicare. I think all of those are very good reasons to be selling this product.
Yes. So when's the time to sell? When are we going to make that money that everybody's talking about? Well, first and foremost, if you are inclined to want to sell any or all Medicare products, that Part C, also known as Medicare Advantage, or even a prescription drug coverage, you must complete an AHCP certification. So if you look on here, you'll see it's pretty simple. You go through, do your registrations. So for first timers, now keep in mind, this is going to be an annual class that you will have to do and complete online. But for those of you that do not want anything to do with Medicare and you have no intentions of selling Medicare, you don't need to listen to this part. You can sell a MedSup without any kind of AHCP certification.
Right, MedSup that's actually just an insurance product.
So that's governed by the Department of Insurance in your particular area. But this is the federal program that one has to complete if they're going to sell Medicare products. So please note, for the first timers, you got to register. You're going to need your NPN number, your social security number, date of birth, email, you know, all the basic information. Make sure that you document that password. You have to certify again annually, like David and I had said earlier. But remember, it is going to be a shorter version the second time around, because you're not having to fill in all of that registration again. There is a cost associated with AHCP. It's different depending on carriers and some discounts. You will have 3 attempts. Now, please understand, it's 3 attempts for each time you have paid for your testing. So make sure, you know, you study hard. David and I highly recommend that you do a print or a print screen of your tests, your practice tests, as well as the main, so then you can go back as a reference, because again, this is open book. Save those documents. You have a 2-hour time frame in which you can take your test. So you can go back to reference material, again, open book. You must submit or transmit the results to the carrier. Different methods, different carriers. Some want an email with an attached print, some want a fax, and then some want snail mail. So each carrier is different. So when can I sell? So we have an open enrollment period, which starts October the 15th of every year and ends on December the 7th, again, of every year. So, but keep in mind, any and all of these open enrollment period applications that you're submitting are going to be a January 1 effective date. So you'll notice that we have these special election periods, the SEPs. Those are various enrollments that are throughout the year, but you have to have a special election. In the under 65, it's called a qualifying event. Same thing applies, different elections.
Same thing, different name.
Yeah. Enrollments are available all year long. So we have those agents that David was talking about, those 8 persons per second. So people that are new to Medicare have a 7-month window to enroll. This is called their AHCP. They're not bound by the AEP of enrollment. This is deliberate and purposeful on their research. So remember, this particular baby boomer generation that David had talked about, these baby boomers are much more internet savvy than the generation prior. So you'll notice here that they're referred to as the most wired Medicare population. 76% of that population use the internet, 62% have home broadband, 80% have cell phones, and then 55% go online daily. And they're likely to buy online for themselves or for others. Then we have the switchers. So that these are the most common factors for switching. Cost increase, whether it's premium, pharmacy, their co-pays, co-insurance, deductibles, the market exits, of course, the company consolidations, and then of course we have the elimination of the first dollar coverage in Medigap. And then new product offerings, provider exits. So when we say provider exits, we're talking about that primary care is no longer part of the network. A lot of people don't want to deal with a whole new doctor, and they want to stick to the doctor they have had in prior history. And then you have the persons that have moved new to an area, new to an address. And then these are just some of the examples of a special election period. More to come on that, right, David?
I think we'll do a whole webinar on special elections.
So these are just the common. So change of residency. The beneficiary moved permanently outside of their current plan's area. The beneficiary moved permanently and now has a new medical advantage or Part D plans available as a result of that move. And then the person that was incarcerated, now that's not county jail, right, David?
No, we're talking prison time.
Oh, hard prison time, okay. And then we also have the, again, low-income subsidies. David and I will be going into further in future webinars about the low-income subsidy and what it is and how people get it. And then the termination of a plan contract, credible coverage and dual eligibles, which can also be known as those low-income subsidies. So what now, David?
Well, let's talk about how we can prepare a little bit. Get those. I always start off with, get that marketing plan together. Determine exactly who it is that you're going to want to contact. Make sure that your website or your landing page indicates that you do Medicare. Familiarize yourself with the carrier sites and quoting tools. Another good one is on your email tagline. Put a little thing in there, I do Medicare, or I can help with your Medicare. Just letting people know. Now, Medicare has some very peculiar marketing, but one of the things that you're not allowed to go out and solicit, cold call, knock on door kind of stuff, but contacting your existing clients is providing customer service. That is not considered to be soliciting. So you definitely want to let your existing book know that you're now doing Medicare. and centers of influence, doctors, your church, CPA, accountants, lawyers, those kind of people that you should be dealing with already. Then next little thing was, as Lauren had mentioned, you have to get your AHIP done. Okay, AHIP is a certification process where you'll learn about Medicare. Then you're going to want to contact the carriers. Yeah. One of the things I'm always kind of asked about is, I get this question quite often, Lauren, who should I contract with? And we kind of put this together that there's about 3 big national carriers. Depending on what state you're in, you should have 2 of the 3, maybe all 3. But United Healthcare, Humana, and Aetna are the big national carriers. And then regional, I would look at Blue Cross Blue Shield or Anthem. Those are usually particular to a state. And then every area tends to have maybe a local company that does well in there that you might want to look at. Like if I was in Oklahoma, it'd be Global Health. If it's in Texas, it'd be Baylor Scott and White. I mean, there's Pennsylvania's got Capital Blue and Highmark. I mean, there's quite a few that you would just be from what region you're in, and they will be the popular carriers in that area. So I would start off with those 5. I had 18, and so it's a lot to keep up with. So our next little step here is, like I was saying, was each of those carriers, you're going to contact them and do your certification with them. Now, who do you contact? You're going to do broker support. I would simply Google broker support for whatever company I was interested in. And it would give me a phone number or a website, contact them via email, give them a call. They'll tell you what they need from you, such as your AHIP certification, like we were saying. Some of them, AHIP sends it to them. You just ask AHIP to send it. Others will want you to print out your certificate and email them a copy. I mean, they'll let you know what they want from you. Now, the thing about these is get those certs in. Here we are, it's already in September. If you haven't started them already, I really wouldn't waste any more time, and I would get hot on that. When you do all that stuff, save all the PDFs, screenshots, any downloadable materials. All the tests are going to be open book, so you're going to want to be able to get those certifications done. Carefully read those answers before you choose one. Sometimes there's one that's just more correct than the other. Save the certificates, and many of the companies will have live certifications where you can just simply go to a seminar and you'll be certified at the end and get that knocked out in a day. So get to know those systems on the carrier websites. I'm telling you, the last thing you want to do is to be filling out an application online when it's the first time you ever saw the website. Okay. Some of them get a little tricky. Sometimes there's just little tricks that you need to know that you figure it out after the first time through it, but you sure look stupid that first time if you don't know it already. And build that pipeline. Usually, like I said, to build your pipeline, just start with what you already have, and from your book, and kind of expand from there. And just review that book of business and see what you can do. Now, in Medicare, we'd always think of ABC as always be compliant. You've done a lot of work and a lot of studying to get your Medicare certification. And Medicare can be very tricky, and just want to make sure that you do stay compliant, understand all those rules that they taught you in AHIP, and as we would put out during many of the webinars. And so stay compliant and stay out of trouble. So that was, for those who are looking to get into Medicare itself and wanting to do the Medicare Advantage and prescription drug plans. Well, I know that some people don't want to do that.
They don't want to be bothered with AHIP.
Well, that doesn't mean that you're going to ignore that Medicare population. There is still the Medicare supplement. And as far as pure insurance goes, you'll find that the Medicare supplement provides the the most effective cost, because they will literally come in and pick up that max out of pocket for you. Your only liability will be the premium itself, and maybe a depending on which plan you pick, maybe a deductible. Right?
Mm-hmm.
So let's take a look at those.
So a Medicare supplement insurance, also known as Medigap, is a policy that helps pay some of those healthcare costs that original Medicare doesn't cover, like, that copay, the coinsurance, the deductible, protection against that out-of-pocket cost, which if you have an insured and they have this plan, it lets them focus on getting better rather than, oh my goodness, those big medical bills are coming. This also gives the flexibility to see any doctor at any time, and please note, there's no waiting period. Know your plan. Medicare supplement insurance does not provide a standalone coverage, requires an enrollment in Medicare A and B. Now, this is an area I would like to point out. Some people were confused. They said, oh, you have to have A, B, and D. No, it's just A and B. Please note that this does not provide that prescription drug coverage. So if you're one of those agents that is AHIP certified, you have potentially two sales here. You have the MedSup plan sale as well as the prescription drug plan sale. And then note that this does not provide a benefit for vision, dental care, hearing aids, sunglasses, eyeglasses, or private duty nursing.
I'm hearing potential for more sales in there.
Yes, absolutely. And then note that this does not duplicate a benefit paid by Medicare.
Well, let's kind of take a quick look and break these down just a little bit further, because you have to have that A and B. So we'll start off with just a quick review of Part A. And the key thing about it was Part A had a $1,364 deductible, and that is not an annual deductible. It's more of an event deductible. So if you're put in the hospital, that's going to cover that first 60 days of what they call the benefit period, is the deductible. Now, you'll notice that there's multiple different plans for Medicare supplements. We usually sell either Plan F, Plan G, sometimes Plan N, and even maybe a little rarer, a Plan F high deductible. But that F and the high deductible F are really the same plan. It's just that obviously you have to meet a higher deductible with the high deductible. Now, Medicare Plans A, or MedSup A, it's just that is a requirement from CMS that if you want to have a supplement at all, you had to offer a Plan A. But there is a whole alphabet soup of plans, but we're going to concentrate on the F, G, and N. So that first 60 days, you had to pay that deductible, and you would see that in Plan F, it covers that deductible for you, as does G and N. And then as the price went up, after day 60, it goes to $341 a day. All three plans continue to pay that for you or for your customer. And then after 90 days, it goes up to $682 per day in the hospital. And again, all of the plans would cover that. If you are on straight Medicare with no supplement at all, that's where Medicare stops paying, and the individual would have to exhaust their own money for any further hospital stay. Again, the plans, they cover that. Then blood. Medicare itself does not cover the first 3 pints of blood. All of these plans will cover that for you. And guess what? Most procedures require 3 pints or less. Hospice care. Now, Medicare itself fully covers hospice care, so you won't see that having a supplement is going to really help with that. That's just one of the features of Part A. Skilled nursing facility. Medicare, again, covers the first 20 days, but after that, the cost goes to $170.50 per day. So any of the supplements would continue to provide that coverage for your customer. An extended stay, in a skilled nursing facility. Okay, so let's look over at Part B. Part B has $185 deductible. Part B is all your medical stuff. That's your doctor visits, lab work, medical supplies like anything from wheelchairs, CPAP machines, or diabetic supplies. So again, Plan F covers the $185 deductible, but that's the only one. And as we may have heard, that is going to go away for all newly eligible Medicare beneficiaries. So that's that elimination of the first dollar amount that we were talking about. So Part B deductible is going to be covered only in Part B. But the co-insurance, the other 20%, Medicare covers 80% of the cost, leaving our customer with 20%. And here's the part that most people don't always understand. There is no maximum out of pocket. As I've said over and over again, if you could find a doctor that would see you for $100, your share would be 20. And they want that at time of service. If you had to have a surgery and it was $100,000, your share is $20,000. And again, they want that at time of service. So all the Medicare supplements will pick up that 20%. Excess charges. Got to be careful with that one. Medicare is allowed the doctors to charge 15% above whatever the cost code is. And so that's what they would know as balanced billing. The only one that doesn't cover that is Plan N, but F and G do cover that. And again, like we had said, the blood is all covered by all of the different plans. Home health care, again, fully covered by Medicare, but durable medical equipment is subject to the deductible and the 20% coinsurance. So if your customer does need that wheelchair, CPAP machine, or any of the more expensive home equipment, that gets pretty well covered by one of these plans. And the final benefit that I like to point out is that Medicare itself only works inside the US and the US territories. So if you have customers that travel outside the US, their Medicare will not cover them in a foreign doctor's office or hospital.
Regardless of it being an emergency, right, David?
That's correct. It's not except for, it is Medicare does not work outside. They have no method of billing. So you're simply going to be on the hook for the entire bill. Now, with a supplement, though, you do get a break. You do have all these plans. They'll give you a $250 deductible per calendar year and a lifetime limit of $50,000. So the real goal being, let's get you stabilized and returned to the US for treatment. So they do provide that emergency care received outside of the US. Let's talk a little bit about eligibility for these plans.
So again, eligibility, as David is saying, these are the minimum requirements. So we have a covered under, are you covered under the ages of 65 or ages older? And then they have to have A and B, not A and or B, which some people we notice have been getting a little confused. And are the Medicare eligible due to disability in a state requiring under the age of 65 coverage? So basically, let me break that down. Not all states are going to offer a MedSup plan for personnel that are on Social Security disability, even though they have been deemed permanently disabled and are collecting Social Security disability. The requirements are varied from state to state. So some states will have that MedSup plan for under 65 personnel that are on Social Security disability. So you're going to have to kind of pay attention to your state and as well as the carriers, right, David?
You are. So that kind of puts it together here. Thank you for attending. And if you do have any questions, just email us at the training box, and we'll get right back with you.
Yes. So we're just gonna leave you with the ideas that, again, as David has said, if you need any assistance, if you question something, if it's product knowledge, or if something is going to be compliant, if you question it, make sure you email that training box, and David and I will get back to you as soon as possible with that information. David and I want you to focus on doing what you do best, which is selling. So guys, we're going to be signing out here. We hope you have a great day, and thanks for hanging out with us and spending some of your time with us.